I'm Emma Boulton from Clinic 66, and before we get started I'd just like to let you know that I'm going to be using the V word, that's vagina, the S word, that's sex, and definitely using the M word, which is menopause. So if that doesn't appeal to you, then I suggest you switch off straight away. Many women, in particular menopausal women, experience debilitating symptoms such as vaginal dryness, reduced sensation, frequent or recurrent urinary or vaginal infections, painful intercourse. And these are often the cruel and debilitating symptoms of menopause, although they can be experienced by younger women if they've had to have a hysterectomy with their ovaries removed or treatment for breast cancer. You may have been diagnosed by your GP with vaginal atrophy or atrophic vaginitis, all of which are symptoms of a syndrome called genitourinary syndrome of menopause. Now, not many GPs know that there's a new and effective treatment for these symptoms using a CO2 fractionated laser, otherwise known as the MonaLisa Touch treatment. MonaLisa Touch is a fractionated CO2 laser. It's non-surgical, non-hormonal, and it's performed here at the clinic to alleviate those symptoms. It's done while you're awake, you remain comfortable, and the idea is that we deliver precise amounts of energy using a medical laser. What this does is promotes collagen formation and improves blood supply, making the tissues stronger, more robust, and reducing those symptoms. It also helps with the biome, with those bacteria that live within the vagina in a healthy balance. And with genitourinary syndrome of menopause, sometimes that biome becomes unbalanced. So the CO2 fractionated laser is a way of turning back the clock. It helps regenerate those tissues and reduce those nasty, debilitating symptoms. One of my patients calls it a facelift for her fanny. The MonaLisa Touch treatment might be good for you if you want to treat or prevent the symptoms related to estrogen reduction, which commonly occur at the time of menopause. It might be good for you if you have vaginal dryness, a lack of sensation, itching, burning, discomfort, and frequent urinary tract infections or troublesome urinary symptoms. It might be good for you if you feel that your vagina has changed since giving birth. And it might be good for you if you prefer not to use hormones, or if you've been told not to use hormones, such as women who've had breast cancer treatment, or if you've tried hormones and found them ineffective. There are some women who it might not be a good option for, such as women with prolapse, such as women with complex pelvic repairs, women who are on anticoagulation treatment. But if you're not sure, make an appointment to come and see one of our doctors and we can decide whether it's right for you or not. I wouldn't want you to think of the MonaLisa Touch treatment as a cosmetic treatment. It's not a labiaplasty or a vaginoplasty, a designer vagina. The CO2 fractionated laser is primarily intended to reduce the symptoms associated with estrogen reduction, such as dryness, irritation, discomfort, painful intercourse, urinary symptoms. There are other lasers that are being used as primarily to treat laxity by causing the tissues to tighten. But for the MonaLisa Touch treatment, that's not its primary purpose. Having said that, some of our patients and their partners do report an improvement in tone and a reduction in laxity after they've had the treatment. The procedure of MonaLisa Touch treatment is very much like a normal gynecological examination. One of our specialised GPs, a women's health doctor, will insert a small probe into the vagina and then deliver a series of very precise amounts of energy, which feels like a small vibration within the vagina. It's not painful, anaesthesia is not required, although we do use a little bit of topical anaesthetic onto the very sensitive areas just at the opening to the vagina. You can drive home afterwards, and you can resume normal sexual activity 5 days after the procedure. We would recommend you wouldn't do vigorous exercise on the day of the procedure, but by and large you can resume your normal day-to-day activities without any limitations. Women vary in terms of their requirement, but the research evidence has looked at 3 treatments delivered 4 to 6 weeks apart, and that seems to give them the most benefit. Most women see really good results after the first or the second treatment, and then the third just tops them up, and then often women will come back every year for an annual maintenance treatment. It's a little bit like going to the dental hygienist, in that you have to have regular top-ups in order to maintain that healthy tissue. Most women report the greatest benefit after the first or second treatments, and then after the third treatment, that's when we will see maximum benefit. And then many women come back for an annual treatment thereafter. Some women will need to have an altered regime, such as women who have very severe symptoms of atrophic vaginitis, such as women who've been through chemotherapy for breast cancer, or women who are over the age of 60. And under those circumstances we may vary the regime. But on the whole, most women will see maximum benefit having had 3 treatments 4 to 6 weeks apart. Most women find that they would like to have a top-up about once a year, but it may be that you can go longer, or it may be that you return sooner than once a year. It's really around managing the symptoms, and if you feel that you have a recurrence of your symptoms, then you can come back and have an earlier treatment prior to your annual review. Likewise, if you're still getting really good results and it's been a year since your last treatment, then you might want to prolong it and come back 18 months, or just when the symptoms return. As a specialised women's health practice, we see a lot of women who are experiencing menopause, and we are keen to find a solution which works for her, for our patients. And MonaLisa Touch treatment is just one of the things that we can offer to help alleviate the symptoms of menopause. What I would suggest is that you make a consultation appointment as soon as possible to see whether MonaLisa Touch treatment is right for you.